As it looks like day 10 of coronavirus is officially D-Day, with researchers finding it's when patients with a severe form of the virus are most likely to be admitted to intensive care. Sue Dunlevy, the national health reporter for News Corp, joins me now via Skype. Thanks for your time, Sue. Fascinating column that you wrote today, or news story. Tell me why day 10 has now emerged as such a critical day in the way people sort of manage themselves through this disease.
Well, as you saw this week, it was the day that Boris Johnson actually ended up in the ICU, and that's what the researchers found, that 80% of people will get a mild illness from this virus, but for those 20% or so who get severely ill and need to go to hospital, day 10 is the day that their breathing gets so bad that they normally enter ICU. Most of them will probably around that same time end up on a ventilator to help them breathe. And there's a particular severe outcome for some people where they enter what's called a cytokine storm. And that means that their immune system has gone into overdrive and it's producing so much inflammation that it's starting to attack the body's organs, the lungs, the kidneys and other vital organs, and that can actually kill them. And the researchers found that sort of syndrome sort of hits about the same time at day 10.
There's also heart complications that's been certainly a factor in a number of cases. And I listened to a medic in the United States talking about how basically heavy someone's lungs get if they've had it in a very severe way. And the lungs, which you all know are a sponge, basically fill up with fluid, and there's a level of exhaustion of trying to breathe before people then go onto mechanised assistance, ventilators and other things. What are some of the characteristics at the serious end of this disease that we should be aware of?
Well, that's one of them. So, yes, that's what happens is that your body produces so much inflammation trying to kill off the virus that your lungs become overwhelmed with this fluid and you can't breathe. At the end stage, when you enter this cytokine storm, that same inflammation can put you into renal failure, so your kidneys don't work properly cleaning your blood, and other vital organs can also be affected and stop working, and in many cases that's what actually ends up killing the patient. So it can be quite severe, but some people get it at the other end of the spectrum where their symptoms are so mild they don't even know they've had it, and others it might just be a few days of a bit of a fever and a cough, and then I think typically by around, I think it was day 14, people who've got the mild form of the illness generally have recovered. But if you survive the severe end of the spectrum, I think half the patients were in hospital for at least 42 days, and some of them even beyond that, because once you get to the stage where you need ventilation, that's an extremely invasive process, and it can take quite a while to recover. So patients have to be essentially put into rehabilitation before they can get out of bed and go about and learn how to speak again and stuff because of the...
And that's why, Sue, isn't it, that we see sometimes quite a lag between infection numbers. We get a big spike in infection numbers, and then we don't see much in terms of the death numbers until we get past sort of that day 10 and then beyond, where people might be on ventilators and then they come off them. Give me a sense, if you get it, if we know that day 10 is a really big watch day, if someone's at home, and most people do stay home when they have coronavirus, only a few cases end up in hospital, is there a daily call every day from health authorities to check whether or not your symptoms have progressed to something worse? How does it manifest at home?
I think that's the case. I've spoken to a few people who've been in quarantine and had the disease, and they tell me that there is sort of like a daily phone call. The other thing that used to happen in the early stages of this was that patients would have to pass 2 tests to prove that they were negative for coronavirus before they were allowed out of quarantine. Now, we learnt this week that follow-up testing is no longer taking place. I suppose partly because we had a shortage of tests and we didn't have enough of them. But there's some people who, even though they've served out that 14-day quarantine, have insisted on having a follow-up test and found that they still felt ill, and it was found that they still tested positive for the virus. Now, the Department of Health says that it's unclear whether when they test positive they're still infectious, so that's why they're not bothering with these follow-up tests anymore. But they do advise patients that have still perhaps got a fever and not feeling well at the end of that 14 days perhaps to get the all clear from their doctor before they start, mingling with other people again.
Look, it's clear there's just so much we still don't know, or we're only just finding out, and I found this the stuff that you had today about day 10 being very, very fascinating. Sue Dunlevy, thank you very much for your time.